Because I smoked, I damaged the alveoli in my lungs. Because I damaged it, when I breathe in, not all that oxygen gets into my bloodstream.
In everybody's lungs there are little tiny air sacs, tiny air sacs, called alveoli, I think they're called. In mine, about 30% of those have gone flat.
Inflammation or swelling in the breathing tubes, called airways or bronchi, results in damage. These bronchi become narrowed so that the airflow in and out of the lungs is reduced, so that you feel breathless. Sometimes there's also damage to the air sacs or alveoli, the grape-like structures at the end of the airways, where oxygen is absorbed into the bloodstream. Being out of breath is the most frequent and common symptom you'll experience as someone with COPD, but as we shall see, it's not necessarily dangerous in itself. In fact, when done correctly, getting out of breath can actually be good for you.
It's not bad for you, but what it is it can be really frightening. And if it's frightening, that can make you put your heart rate up, can make you get really anxious, can make you get really scared, and that isn't nice and isn't pleasant. So what you really need to do is you really need to learn how to actually cope with that breathlessness.
I wouldn't exercise because I get breathless, and nobody likes being breathless. But in actual fact, it is good to be breathless. Breathless won't kill you.
Breathing it is obviously quite critical, and managing it. More to the point, learning not to get anxious when you get short of breath, because breathlessness is part of COPD. And it's about coming to terms with, I am going to be breathless, but that doesn't mean to say I can't do things.
I can feel when I'm starting to get out of breath, my chest tightens up and my mouth goes dry, and what I do, I tend to sit down, even if it's just for 5 minutes, take some deep breaths, do my breathing exercises if I have to get some air into my lungs, and then off I go again.
There's lots of different types of breathing techniques and lots of different positions, and patients will find their own position works for them best. There's a range of them.
Alison Sutherland is a British Lung Foundation respiratory nurse specialist in Nottingham. There are respiratory nurse teams all over the UK. She works in the community and helps people manage to live well with COPD.
When people take a big breath in, they go, and the shoulders go up and use all the accessory muscles, and the air doesn't go down very far, and it's not very useful. So when you take a relaxed breath, you're trying to use this big umbrella of muscle that's at the bottom of your rib cage, and that's called the diaphragm, and it flattens, and that creates space in your lungs and the air is sucked in. So you breathe in through your nose with your mouth closed for a count of 2, and at the same time you're trying to push your tummy out. Your diaphragm will flatten and your tummy will push out. So you breathe in through your nose and your tummy goes out, and then as you breathe out, your tummy goes in and you breathe out through your mouth.
Practicing some good breathing techniques when you're in a relaxed situation will help you use them confidently when you really need them.
When people get breathless, what they naturally do is splint their chest, so they press their arms down on something. Now that might be a windowsill or a shopping trolley. You brace your arms against it. You might want to lean forward and drop your head a little bit, or you might want to look up as though you were leaning on a windowsill and looking out the window.
My most comfortable position, especially if I'm slightly out of breath as well, is actually leaning on the back of my chairs in my dining room, and I can breathe better.
You would never, ever see me push a supermarket trolley. It wasn't a man thing, you know, in my previous life, if you like. Now, I can't wait to get over to the supermarket trolley because, really, it's my walking frame.
When you go to the supermarket, if you use a trolley as opposed to a basket, when you do get out of breath, you can actually lean on the trolley and use it and go it slowly at your own pace. If you feel like stopping, you don't look awkward because you stop, because you've got a shopping trolley you can lean on while you're thinking of what you want to buy. It gives you time.
Breathing techniques and positions help you manage your breathlessness. By pacing yourself, you can ensure that you do what you need to do without becoming too breathless.
The things that make me feel breathless are inclines, walking on inclines, walking upstairs, or heat.
People say to you, slow down. Don't be running around like a loony. But if you've been used to being an active person, which I was, I found it very difficult to slow down. But then I began to realise that with this COPD, you've actually got to pace yourself. If you've got COPD and you've got to live with it, try to make your life easier by doing things in stages. Work out in your own mind what you've got to do and then how you're going to do it.
You have to get yourself a routine. When you do the things that you normally do, you have to build a routine into that just to stop yourself getting breathless. So, for example, what I do, I leave home and it's probably a couple of 100 yards down to the end of the street, and I stop before I actually get breathless, have a rest, get a couple of breaths and then go again. And that ensures that I don't actually get breathless. The biggest tip is to stop, no matter what you're doing. It doesn't matter if people are embarrassed or anything, it doesn't matter. If you feel breathless, stop. It's good to lean forward a bit because it opens up whatever's in there. Just lean forward a bit and have a few breaths. Ignore everybody else, it doesn't matter. It's not their problem, it's not their concern.
Everything takes twice as long. I ain't got time for this disease, if you like. I need to be doing a job. You know, I need to look after my family, my granddaughter. So I have to allow myself more time. I don't beat myself up anymore if I can't do what I need to do. I just do it at a slower pace.
It's important to practice your breathing techniques when you're relaxed so that you're able to use them effectively when you need them. Learn some good positions to help you recover from breathlessness and learn which ones work best for you. Pace yourself. It's the key to managing your breathlessness with your daily routine. And remember, whilst being breathless can be unpleasant or frightening, it's not dangerous in itself. Learning to cope with breathlessness will make you feel more confident and allow you to do more. If you need medical help with your breathlessness, the most common treatment you're likely to receive is using an inhaler.
The main thing that we use to relieve breathlessness from a medication point of view is a blue inhaler. So you should always carry your blue inhaler around. There's lots of different devices out there, and the important thing is that you can use yours properly when you're breathless. Lots of people can use them when they're not breathless, but the point is you need it when you're breathless. So inhaler technique's really important. Inhalers are difficult to use. They use inhalers because the drug goes direct to the lung, so it's quick acting.
Inhalers come in many different varieties. Some are to be used as relievers and some at specific times each day. Be sure to understand the difference. There are some basic rules you must always follow. In order for an inhaler to be effective, you'll need to use it correctly. Timing your breath in with the firing of the device can be difficult, especially when you're breathless. It may help to use a spacer for certain types of inhaler. This is a plastic cylinder designed to make a metered dose inhaler easier to use. But it's very important that you have your inhaler technique checked regularly by your doctor, nurse or pharmacist.
Each year you should be tested either at the doctor's or now the pharmacies are doing it to make sure that you are still taking it correctly.
Inhalers are very effective but can be difficult to use properly. It's vital to learn a good inhaler technique for whichever inhaler type you've been prescribed so that you receive the full dose each time you use it. Make sure your doctor, nurse or pharmacist shows you how to use your inhaler and get your technique checked regularly. Set aside time especially to take your inhalers, ideally when you're free from other distractions. And practice your technique when you feel well and calm so that you can use it effectively when you're breathless. If you need any further advice on inhalers, you can always contact the British Lung Foundation helpline on 08458 50 50 20.